All right. Here we go. Are we in? Have we started? Can we pop a one in the chat if you can hear me? Having some challenges this morning. What's happening here then? Yes, thank you. Thank you, Sarah, because otherwise I'd have just been stood here for the next half an hour going, oh, what's happening? So welcome. It seems that Teams is letting everybody in without me pressing any buttons this morning, which is making me nervous. And this is definitely a first because I'm starting this webinar on my own. Welcome, welcome, a warm and friendly welcome to a Wednesday morning webinar with Exxon Health. Delighted to have you here. And thank you for jumping in and letting me know that everything's working as it should. That's really helpful to know. I say it's all working as it should. We're currently missing our lead speaker, but it's fine. It's fine. Everything's fine. We'll just keep going until he jumps on the call. All right. Well, I'll tell you what, before we do get started, I want to show off my Vietnamese skills. So Chuk Mung Nam Oi to all of those who are celebrating the Lunar New Year this week. So happy, healthy, prosperous year of the horse ahead for you, we hope. I'd love to know actually where we've got people tuning in from as well. So if you are, I'm hoping we've got all four corners of the country covered, but do let us know. So whilst we're all chatting, let's pop some comments in the chat and tell us where you're tuning in from. Especially you, Max. Where are you? Loughborough. Thanks. Thanks, Anne. Ben in the southwest. We're looking good. Aylesbury. Okay. Newcastle. Lincoln. All right, we're doing well. Okay, we've got. I'd say that's all four corners covered. We're not yet over the border into Scotland, Wales, and Northern Ireland, but we'll work on it. Thank you. Oh, we've got Newcastle and Sunderland on the call. That's nerve-wracking. All right, no worries. That's great. Thank you for jumping on, and fingers at the ready, it seems. So that's good. Feels like I'm travelling the four corners of the country this week. I mean, slight exaggeration, maybe. It's more like the two ends of the M1. We had, what was this? It's not actually, Sarah. Delighted for you, absolutely delighted for you. Big heart on that one. Yeah, two ends of the M1 this week. Nottingham yesterday on the AI tour bus, Newcastle on Friday. If you haven't joined us yet, it's not too late. If you've no idea what I'm talking about, it's of course the CPD accredited learning course around AI in primary care. I'll pop the link in the chat. As I say, it's not too late to sign up. We've got some more dates in the diary, and I'd love to see you there in person, especially if you're keen to demystify how AI really works in healthcare and address the challenge of clinical safety. So do join us on tour. Awesome. Right. Today, Max, you're here. I heard you heavy breathing somewhere. I can't see you, but you're there somewhere, right?
Morning. Yeah, heavy breathing. I couldn't access the link, so I was scrambling around, but I'm here.
You were scrambling around. You were scrambling around. We'll be having words later, let me tell you. Right. Okay. Listen, it's a very exciting update today. I'm thrilled to have you here. It's the very first true integration, I'd say, between Assist and Connect, a giant leap towards this thing that we keep talking about, the intelligent care navigation system from Exxon Health's growing technology portfolio. So yeah, I'm really excited to hear what you've got to say today, Max. I think it's going to be good. With that in mind, we've got a very active audience, so I'm going to give you my icebreaker, fingers at the ready. If, a big if, your practice phone line didn't exist tomorrow, sharp intake of breath, how would your patients ask for help? So if your phone line didn't exist tomorrow, how would your patients ask for help? Pop your comments in the chat. Sarah Walker, straight on there. You don't win any prizes, you know, Sarah, for being first, but you, apart from my, absolute love and affection. Online, yes, brilliant. Okay. So if you're new here, we love your thoughts. So just pop them in the chat as and when they come to you. It's a safe space. Don't hold back. But enough of all that. Whilst you're replying to that question, I'll get on with my usual bit of housekeeping before we get started. So firstly, to say the call is being recorded for prosperity sharing, and so I can smack Max with it later. We're only going to keep you for about 30 minutes. So if you need to drop off at any point, don't worry, the recording will be sent to you because you're here with us right now. Second of all, as I say, we love the questions. Pop them in the chat as they come to you, and we'll get to them as we can throughout the webinar. My name's Lucy Glynn. I'm the community manager here at Exxon Health, and with me today, I don't know if you deserve this intro now, but here we go. The man of the moment, our digital transformation specialist, and all-round know-it-all, Mr. Max Gatlin. See, I was going to give you a really big round and drum roll and everything, but anyway, Max, how are you? Are you well?
Yeah. Very good. Yeah, very good. Yeah, very much focused on primary care digital technology, but can't get myself into my Teams link. So, yeah.
We'll try not to dwell on it. Okay, fine. Max, there's been some really exciting developments, hasn't there? So tell us about them.
Yeah, I mean, your intro and as we speak about the intelligent care navigation system, it's more important now more than ever, really. I know over the last 5 years, we've seen lots of funding coming in, lots of focus on patients and access. We tried increasing the capacity side of things with enhanced access hours or extended hours hubs, which is working to a certain degree. And then lots, as we know, lots of time and effort gone into demand and access channels. What we've seen over time really is that we saw that the telephones were an issue, and we tried to launch, as everybody's put in the chat there, launched online routes. So we opened up online routes, which has been a help. But what we're starting to see is actually, is that problem or demand still popping up in general practice where we don't have the additional capacity to manage it? So the shift from telephony to online, and now there's talks of obviously moving from online channels into back to voice, but automated voice, which is really exciting. And of course, we're developing lots of solutions that help navigate the patient through these different channels. The other route, of course, is Surgery Assist. So Surgery Assist is, instead of just shifting that demand down across those channels and the demand popping up within your surgery, it's actually helping to manage it. So effectively managing, and I say managing, sometimes that's misconstrued with shifting. It's not. It's true demand management. So what we're going to look at today is how those real 3 key core channels that patients can come into the surgeries. Of course, I'm not forgetting walk-ins. We should absolutely be allowing walk-ins and accepting requests from patients into surgeries across the front desk. We shouldn't be telling them to go home and submit a request online. That isn't inclusive at all. So I'm not forgetting the walk-ins, but I am just going to highlight today of how, looking at all of those different channels, largely digital at the moment, how we can effectively navigate patients through the system. And we know that the entry point by default is general practice for a lot of demand that doesn't necessarily belong in general practice. So yes, Surgery Assist is helping to filter out some of that demand, but actually if it does belong in general practice, how does the patient make that request to make sure they can get an access and a resolution first time on their first contact, rather having that demand trickle or waterfall down through the week? What I mean by that is, patient calls in on Monday morning, the lines are too busy, so they drop out, try again Tuesday, try again Wednesday. That is not conducive to efficient ways of working. It's not conducive to enhanced patient access. So what we're going to touch on today is integration across those different channels to allow patients to ensure they get to the right place first time in a way that they need it, whether that's phone, whether that's digital. So yeah, really exciting to show you the first integration of the core pillars of intelligent care navigation system between Connect and Assist today.
Hopefully that will also help to explain why we've got all of these different logos. I get this a lot. We go to events and things and people go, but why have you got Surgery Connect and Surgery Assist? And it's so exhausting. But I think it really starts to show why we've got the 4, as you call them, pillars of technology, but also how they start to work together as one seamless, integrated system. I think that's the bit I'm most excited about. Yeah, as a patient, more than anything.
Exactly. We are all users of the system, right? And we're all in it because we want to improve it. So we don't leave anybody behind. And over the last 3 or 4 years, we've moved to kind of, in living in a post-COVID remote world, dare I say, we just don't want to leave anybody behind. And whilst we've done incredible work in configuring some online solutions in every surgery across the country, we're now coming to a time where there is a bit of perhaps digital fatigue. 4 different suppliers, we're losing patients along that journey. There's not really one single system that can track a patient through. And of course, if you can follow a patient through the journey that they've got in accessing your service or a local service, then you can tweak the design pathways or care pathways for that patient and your citizens, further improving the health of your population and the care for them. So what the intelligent care navigation system really is one single system. And the most important thing is being able to track a patient through that journey. So the exciting thing about this is not only allowing the patient to self-serve at the point of need, but be navigated to the right place through the right medium or channel that they need to.
And I suppose something you just touched on there that's probably prevalent to most of the people on this call is being able to see where they're going and track that data and make adjustments accordingly.
Exactly, yeah, and that's the kind of fourth pillar of the the intelligent care navigation system really is our insights platform, which is the data. And I say it every time I'm speaking to our partners across the country, that we want to sit down and review the data with you. We're not just going to send you the data. We want to sit down with you, understand why there were surges. Was it because the capacity dropped, or was it because demand surged? And what can we put in place to prevent that from happening in future?
Very exciting.
So I will now show you the first integration between the two core pillars, as we've kind of referred to from an access point of view with a patient, between Surgery Connect and Surgery Assist. So for those of you that don't know, the Intelligent Care Navigation System was kind of designed and put together by the team here at Exxon Health, because we started to recognize, right, how do we know how to connect the patient to the right service, but how do we do it first time with minimal impact on the capacity in the surgery, but maximum benefit to the patient, i.e. speed up time to care, access 24/7 and on weekends, etc. And also offer them access to that service in the right way, whether it's via voice, whether it's online, whether it's in person. So we've kind of come up with the Intelligent Care Navigation System, and on the left hand side you can see the point of access, and following that you can see that the patient is navigated and routed through various channels by which anyway they need. We're not going to go through the whole thing now on this call, but there's a QR code there, and you can scan that and access the full document that has the Intelligent Care Navigation System, and then each of the core products and features that come within it. Today we are looking at Connect and Assist, but largely focusing on Assist, and it's the integration between the two that we're going to look at. Okay, so what I'm going to show on screen is the ability for, if a patient is interacting with your Surgery Assist digital assistant, typing in their problem, being navigated elsewhere, if they do need support from the surgery, how do they get it without having to add to your call queue coming into the surgery? For those of you that don't know, that are coming into this, Surgery Assist will meet the patient at the point of need, whether they call in, whether they visit your website, or whether they walk in. We've got some fantastic 5-foot cardboard cutouts being shipped all over the country at the moment for those patients that do walk in, but just need a little bit more support digitally. Of course, the launch of the language detection feature soon. I won't put any dates on that, but language detection, having the ability to scan a QR code of a 5-foot cardboard cutout avatar in your waiting room, or have an iPad ready in the waiting room, but the ability for a patient to ask questions in their own language. Super excited for the launch of that. So yeah, Surgery Assist will meet your patient at the point of need, and the whole point is we envisage, or we understand from our data, that a well-trained Surgery Assist digital assistant, which is trained locally to you, and I've got a whole 45-minute webinar on hyperlocalization and our approach to that, which I'm sure we can pop a link in the chat to before we leave. We can signpost effectively 40% of the demand that comes into general practice. So all of that demand I was talking about previously, general practice is the default for lots of things, whether it's weight management, social prescribing, housing issues, benefits. I've seen bin collection questions, everything coming into general practice. But that's the beauty of Surgery Assist. We can train all of those responses to automatically signpost a patient, surface the correct links, surface forms, and signpost patients into the appropriate service. A key one being self-service. If your digital assistant that you launch within your practice can help a patient self-serve at 9 p.m. in the evening, whether it's the NHS app, whether it's signposting them to smoking cessation or something like that, it means that demand is not going to come back in at 8 o'clock in the morning. So where I started the call with true demand reduction, that's exactly what we're seeing within general practice. So the demand is coming in, Surgery Assist will meet it, effectively signpost and safely signpost 40% of it away, and it will in turn protect your capacity. But if I go back 2 steps here, you'll notice that we've got this route. We will never block or prevent a patient from needing to speak to a human within the surgery. It's not within our beliefs. We don't believe that to be the right way to do it at all. So whilst we can embed or deploy these kind of filtering systems, if it's Surgery Assist, if it's your online consultation solution, or if it's your website, a patient should be able to access a member of your team should they need it. So what we're going to focus on today is if Surgery Assist can't solve the patient's query, and again, I cover hyperlocalization and the supervised way that we train all of our Surgery Assist chatbots, but if for whatever reason it cannot answer, how does a patient then speak to a human effectively without having to add to your telephone call queues? So the best way to show you that is a live demo. So we will jump right in. And again, please do pop any questions into the chat however you wish. So I'm going to do a couple of examples. I'm going to call into my GP surgery straight off. And again, there's lots of different examples of when this might trigger. It might be training hour in the surgery. But let's say I offer to self-serve and I receive a link to my digital assistant. So I've called in because I thought that's what I needed to do. But I'm offered, I haven't really got time, I'm short on time today. So I've decided to self-serve through Aria. And again, this could be 9 o'clock in the morning, 8 o'clock in the morning. As you can see, within Exxon Health, we've got no callers in our call queue, which is fantastic. Those of you that are looking to, again, this is a slightly separate feature that's just been launched earlier this month, is our call queue widget. So we're now surfacing, because of the integration between Connect and Assist, we can actually tell all of your Assist users when they're using the chatbot or speaking to the chatbot, how many callers are in the queue, or what the longest call queue duration is at the moment. And what that means is that if there's no callers in the queue, a patient knows they can call and they'll get through. If there's a large amount of patients in the queue or there's a long wait, they may just spend more time speaking with your digital assistant and aiming to self-serve. So I'm going to flick through. And as we're showing off one feature, I'm not going to go into a full live demo, but I am going to go through and ask a question to Aria. So I'm just going to ask any odd question. And let's say, just going to go through a bit of a privacy notice. Again, everything you see on screen is customizable. But now I am speaking with the surgery. Let's say, want to speak to a doctor. I'm just going to make it a bit more of a conversational flow rather than me automatically calling into the surgery. So if I say I want to speak to the doctor, Aria is going to come back with a bit more of a question. She's not going to say, go through and complete a form and it will land with our team. We don't want that. You've got to think back to the diagram on the previous slide. We want Aria or Surgery Assist to signpost elsewhere. If I did ask for, let's say, what's the surgery address? Got the surgery address, but wow. How do I?
There was that nervous wait with the live demo, isn't there? Where you just typing.
It is, yeah. I'm going off piece a little bit and just typing in a few conversational bits. There are various ways of contacting us at the surgery. Please click on the contact the surgery option below. And as you can see, we've got a contact the surgery option below. There's lots of different questions I could have asked within this. I could have had a conversation and been signposted elsewhere, as you can see. But in this example, I'm just going to contact the surgery. Or we might, actually, let's just do that. Just looking at the clock, Lucy, sorry. I'll click contact the surgery. And again, you have complete control over how your patients will contact the surgery. Okay, so you may not have an email that you want to pop in there. We of course always advise that you do offer your telephone number to your patients. They could submit an online request because they may need to. They may not want to speak out loud about the certain ailment they have because they're in a public place. They can go back and ask another question to Aria, visit your website. And the new feature that we're all here to talk about is request a callback. So in the flow that I just followed, I called the surgery. I've gone through, I've tried to self-serve, but let's say on this occasion, I haven't been able to succeed in doing that. So I do want to speak with somebody at surgery, but I don't want to have to pick up the phone again and wait in the queue. It might be because I can see that there's 15 callers in the queue. What we do within the chat is we can click request a callback. I can then confirm the number that I want to be called. And of course, what we need to do in this world is verify that the patient is actually holding that phone and that's their correct number. So we'll text the patient with a link. I click that link and I confirm and request a callback. In the same way that it works within Surgery Connect when a patient requests a callback, it's exactly the same way within Surgery Assist. So it comes into the same callback system that you're using already within Surgery Connect.
So it's a consistent user experience between the two products.
Yeah, absolutely.
Or patient experience, I should say. That's very clever.
And user experience from in the practice point of view. It just joins their existing callback queue. So then it will call the patient back. We have also, I should add, that the other way around, if you call into the surgery, I haven't got a demo of this, but if you called into the surgery and requested the call back first, you will also receive a screen like this as a patient. And what we're seeing now where we're deploying this kind of integration between the two products is you are positioned 17th in the queue. While you wait, why not speak to Aria, our new digital assistant? And then those that are waiting a callback can also go and try and self-serve digitally if they wish.
Wow. Okay. Well, I'm wowing. I hope the audience at home are as well. So just to be clear, though, from the practice point of view, what does this look like on a day-to-day? Is this just another inbox that they need to monitor? I think you said something about it all coming in exactly the same way.
Yeah, all coming in the same way. So you do need your request to callback feature switched on within Surgery Connect, which I know our customer success team are urging. I know that it's the majority of the population.
Sorry, within Connect or within Assist?
Within Connect, yes. So within Connect.
Right.
So this is exclusive to Surgery Connect users. So we have direct integration between Assist and Connect. So you must be a Surgery Connect user and also have Surgery Assist. If you have within Surgery Connect, you have your callback functionality switched on, so your request a callback feature switched on. We use the same API call that we do into the system, basically. So it's the same integration. We just surface it in different areas. So if you think back to the intelligent care navigation system, there's all of these different patient entry points. It's just making sure that they can access the right channels whilst they're in another channel, if that makes sense. Because we know that not necessarily just patients with disabilities, but temporary inabilities or wants or needs, they may decide they want to call and not go down a digital route, or if they're in a call waiting for a call back, they might want to go down a digital route. So it's allowing the patient or the system to intelligently navigate the patient to the right channel.
Okay, a couple of questions from the chat. So from Ben, first of all, do you have to have Surgery Assist for this to be able to work?
From within the chat interface, yes. Yeah.
But I question back to you, Ben. Presumably you've got patient callback switched on within Connect already. Let him answer that. And in the meantime, ask John's question. Does it integrate with other digital platforms like Anima?
So if Aria deemed that as a patient and I typed in something that needed a clinical assessment, absolutely, Aria would pass me through to Anima to submit that request for you. Yeah.
Aria to Anima. That wasn't easy to say. Well done, you. Okay. Good, Ben. So yes, in order to sort of progress to this next stage of the intelligent care navigation system, you would need Assist. So to John's question, how much would it cost, Ben?
It's a great question. So this feature is completely free and included for all of our Surgery Assist users. If you like the Surgery Assist cost, again, I think it's as you can imagine, if the more you build of this intelligent care navigation system, essentially the better it is for you. So what we would advise is that without knowing your full stack and what you're using within Exon Health, I wouldn't want to broadcast a cost specifically. The catalogue price for Surgery Assist is 24 pence per patient per year. But again, I'd love to meet with you afterwards, John, and have a chat about your current setup, have a look at what's working, what isn't working, and support you on that journey.
Great question from Azza. We are already struggling to have patients use existing apps and online platforms. How is this different or easier?
Yeah, it's a great question, and I'm more than happy to talk about this on a daily basis. So we designed this solution because of that problem. So I referenced enhanced access from 2022. We were commissioned previously to run a survey on all 1.8 million patients across Bob ICB. We had 90,000 patients respond to our survey. We didn't just ask whether a patient wants to access the surgery on a Monday evening or Saturday morning. We actually asked, how do you usually contact the surgery? Why don't you use NHS app? Why don't you use these digital tools? And overwhelmingly, it's the barrier to entry. So patients don't want to have to download an app, log in, create an account. With Surgery Assist, you don't have to do any of that. It's completely web-based. There's no login required or verification from a patient perspective to enter and ask a question. And the other reason they didn't use digital tools is they didn't know which one to use or how to use it, right? So that's why within Surgery Assist, yes, there's no barrier to enter it and ask questions, but actually it's got all of the bespoke pathways behind it to help navigate the patient seamlessly to the right place. So taking John's example, if it needs a clinical assessment, your Surgery Assist chatbot will navigate the patient through to your online consultation solution. If it is something that belongs in the community, a PCN service or self-service, your digital assistant of Surgery Assist will navigate the patient to to that service or that that guide. It might be an NHS user guide. Here's how you order your repeat prescriptions on the NHS app. Because it's 24/7, because it's got time-based criteria routing, we can navigate the patient effectively to the right place and reduce demand by 40%.
And to that point, John wants some evidence. He would like to know what the evidence is for the 30 to 40% reduction.
Yeah, I think a good way to look at it. So we're seeing that by looking at what's coming through the online consultation tools. So when we deploy this with you, we would look, okay, let's have a look at the requests coming in. If you're already effectively navigating any unnecessary demand that's coming in, then it might be a reduced amount, or it might just support and make it a lot easier to support your current process. But we're seeing typically that 30 to 40% of the demand sitting in online consultation inboxes that's being reviewed by your team is unnecessary and could be signposted elsewhere 24/7. When you start managing demand 24/7, of course, across a 24-hour window, not just your 8 till 6:30 window, you then see a reduction in what you need to process in hours, therefore reducing pressure on your team.
Great, thank you, Max. Udin says, is this compatible with System 1? We already have Connect, but would the website have a chat option?
Yes, it would have a chat option and request a callback as well. Yeah.
A good question from Anne. Will it work if patient rings in on a landline? Thinking about that equitable access piece.
Yeah, absolutely. And we get that a lot. So what if we send an SMS to a patient so they can receive the text, but they can't click the link? Actually, we do the check earlier in the patient journey to make sure there's no failed attempts. So where I called in, I pressed option 1, then pressed option 2, and I received a text. On that call, if you could hear what was said, it said you will have now received a text message with a link. Please go and click the link to launch ARIA. What we do before we send the SMS is a check. So we check the device, the operating system of the phone calling in. We know whether it's smart or not. We know whether it'll be able to open the SMS. If it can't and it fails, then the IVR message in the phone system will say, you're calling off a telephone system that's not compatible with this option. We are, press 1 to go through to the call queue, or press 2 to get a link to pharmacy or something like that. So the beauty of the system is it's fully customized right down to surgery level. So however you'd like to do it. But of course, we've got best practice to make sure that no patients have fail points in their journey of accessing these solutions.
I'll get to best practice in a minute, well brought up. But it's a slightly separate question from Elizabeth Payne. Great to have you back. I've missed you. How have you managed to solve, the problem of patients not being able to cancel their appointment in the phone with System 1, effectively, without speaking to reception? Can they now do it through Surgery Assist? So this is a question around check and cancel, but go on.
Yeah, it is. It is. So with the check and cancel feature that's coming to Surgery Connect for System 1, I won't speak on that. This isn't the same thing, so it doesn't call an API within TPP to cancel appointments specifically. What Surgery Assist will do, and of course as it gets further deeply integrated, it certainly will be able to do that. But at the moment, what it will do is if a patient suggests that they need to cancel an appointment, Surgery Assist will take them through a pathway of how to cancel it from the NHS app. That includes helping them download the app, register for the app, and navigate through the app to cancel the appointment. So whilst it's not the same integration that I think you might be asking about, the outcome will be the same. Not only will you have a patient that's then on the NHS app and able to order their prescriptions and do all the amazing, wonderful things within the NHS app, but it would also show them how to cancel the appointment as well. So there's a wider goal and a bigger benefit here of, if a pathway results in the patient downloading the NHS app and verifying who they are and registering properly with a P9 registration, that will have cumulative benefits for you guys as a surgery as well. So that's what we lean into at the moment.
Fantastic, Max. Now, we're getting into some granular questions here that are probably more will be benefited by a bit of a personal touch from you around whether we've got this set up in Leicestershire practices already. How long does it all take to set up and configure? Which is actually probably one you can answer right now. I was just actually going to put the link in the chat if you would like to find out a little bit more. Perhaps Max, you could do that for me because I've got the wrong link here. So the link to the form, if you'd like to put your details into the form, Max will reach out to you personally and perhaps get a demo set up for your practice, because as he said, this gets very, very specific and very, very practice specific quite quickly. So all right, we are timing out. So I am just going to wrap this up if that's okay. Liz, it's great to have you back. I mean that. And just to go back to your question around check and cancel, my understanding is that is in development as we speak. So don't hold me to it, but I am. It's the one question I really want to give you an answer to. So I will come back to you if I can. That is it from us today. So we hope you've all enjoyed it. Thank you all for your participation. Thank you to Max for his time. Really appreciate it. We will have another webinar in March, so do stay tuned for that. Keep your eyes open for the link. In regards to this one, we'll make the recording available to all the registered attendees in the next couple of days with all the relevant links, answers to questions that we've missed, etc. We'll do it all again next month. But in the meantime, if anybody is heading to Best Practice in London next week, we will be there. Max will be on the stand. You'll be able to talk to him directly and others. There are others available. And we'll do lots of demos and things live for you. So we are on stand D12. We do hope that you'll join us. Annie, I just said I'll send it to you in the next couple of days via email. So if you registered for this webinar, don't worry, you will get the link. In the meantime, on behalf of us all here at Exxon Health, have a happy and healthy rest of February. We'll see you in March for much, much more. Stick with us. There's loads coming. Thanks very much for your time.